Welcome to Yesterday, Today, Tomorrow. My name is Mariana Cordier, and I am your host. I am coming to you from my home via Zoom. Today, I have two wonderful guests to talk about the tale of two pandemics, racism and COVID-19. The United States people have had a profound realization in the last few months that racism and race relation issues continue to significantly wound many of our neighbors in our nation. That the color of your skin, race, or origin can result in discrimination, physical harm, and humiliation. Yet, the equal rights movements and Black Lives Matter movement have been reinvigorated for support for the action and activism and determination to resolve these issues. The combination of the factors of the pandemic, quarantine, and social media have generated unprecedented support to address current racism and race relations. I am proud to have Professor of Sociology at UMB, Dr. Rashawn Ray, to discuss these issues with us today. COVID-19 has been a challenging and evolving infectious disease that has affected the world. The spread of COVID-19 has stressed economies, strained healthcare systems, and frustrated politicians. The United States is confronted with several hotspots that affect the ability to reopen. What is the latest information on COVID and the pandemic? When should we get tested? What should we do? What can we do? Commander retired Stephen Blackwell, a 23-year veteran with the U.S. Public Health Service, having served 11 years with the CDC and currently a senior public health consultant with EHA Consulting Group, joins me today to update us on the pandemic. So for my first guest, we're going to thank Dr. Ray for joining us today. Thank you so much for joining me and Yesterday, Today, Tomorrow show.
Thank you for having me on the show. I'm really excited. Of course, Gloria Blackwell is one of my favorite people. So I'm so excited to be on the show with you and her. And
yes, and Gloria is for the audience, Gloria is our producer. And one of our producers, and she is so instrumental in getting such talented people on the show.
Well, thank you for having me.
So let's talk about race relations and the things that we have seen on our TV and our social media that surprisingly to me is surprising to the majority of the population, that they didn't realize that so many Black and brown folks are having, continuing to have these kinds of issues in their little daily lives.
Yeah, I mean, you're exactly right. I mean, you mentioned two pandemics. And as we're dealing with COVID-19, we also have to deal with America's original sin, and that's dealing with slavery and systemic racism in the United States. And both of them have combined. There's a saying in the Black community, it also applies to Latinos at this moment as it relates to COVID-19, which is that when America catches a cold, the Black community gets the flu. Well, in 2020, when America catches COVID-19, Black people die. And Black people are dying at a rate of about 3 times that of whites. We are also seeing a similar gap between Latinos and whites. Part of that has been the spread of the virus, not just in New York, where Latinos, relative to their percentage of the state population, are 40% more likely to die from COVID. Blacks also have a similar percentage relative to their percentage of the state. But as COVID continues to spread throughout the South, Florida, Texas, Arizona, and California, we are starting to see the ways that structural conditions manifest in people's lives. So we know very early on, a few months ago, that the spike and the gap between Blacks and whites was something that everyone looked at. And I've been writing a series of articles at the Brookings Institution and elsewhere about why we see this gap exist. Well, it's relative.
Let me ask you, why are we seeing this gap? And interestingly enough, when they give you numbers of deaths, they don't differentiate about who's dying and who's not.
Yeah, I mean, that's exactly right. I mean, we don't have the key demographic data that we need. But when it comes to the gap, research overwhelmingly shows, the research I've conducted as well as others, is that structural conditions undergird pre-existing health conditions. So what does this mean? This means that Blacks and Latinos, and we can look at Montgomery County as well as Prince George's County, and the line between the two counties really combining on Langley Park and parts of Silver Spring that are hard hit. We can also see parts in the Beltway in Prince George's County that's being hard hit. And there are a few reasons for this. First, these neighborhoods lack healthy food options. One big thing I've been saying is people have been trying to blame people's behavior or their blood or genetics, is that if you have $10 in your pocket, are you going to go to the Whole Foods that doesn't exist in your neighborhood, or are you going to go to the McDonald's on the corner to feed a family of 4? Most people would make the same decision. It's about structure. We also know these neighborhoods lack recreational facilities, less lighting, less green spaces, less parks, less places to engage in physical activity. They are also more likely to be densely populated. So social distancing or standing 6 feet away from someone is oftentimes a privilege that many of us are able to enact that people cannot. We also know that Blacks and Latinos are more likely to be these new essential frontline workers, people who are working in transit, people who are working at grocery stores, people who are working in healthcare as healthcare aides and the like. They're more exposed to the virus. And then something that should unnerve us all is not only do these factors manifest, but Blacks and Latinos also live in underserved neighborhoods that have less access to healthcare, meaning fewer hospitals. Hospitals are farther away. They have fewer healthcare clinics. They are also less likely to have pharmacies. The pharmacies that do exist aren't well stocked. So if you're trying to actually get some sort of prescription in the middle of a pandemic, it might be more difficult. But then the most troubling one of all is that a recent study found that Black Americans were 6 times more likely than whites to be turned away from COVID testing, even once they get to the hospital. So we put all these factors together. And I mean, essentially it leads to, in the moment of a pandemic, where we actually see a caste system, where we have something like COVID-19 that is an equal opportunity disease, but our society is far from equitable.
Right. And one of the things that is disheartening is that the failure to permit the testing or to test the Black and brown community results in the spread, and it spreads to whoever. It's not, this disease is not discriminating, quite the contrary. And so it would beg the question that isn't it better to treat everyone and equally than not?
I mean, without a doubt. I mean, at the end of the day, part of the problem is that we've taken a colorblind approach to a pandemic in a society that's far from colorblind. What we have to do is we have to center racial health equity. When we center health equity, we then center the people who are most marginalized among us, people who are most vulnerable. And part of highlighting this, one good example is the CARES Act. So this act set out to provide resources for families, resources for businesses. But you know what happened? Black, Latino, and women-owned small businesses were left out in the cold. About 90% of Black-owned businesses did not receive any funding from the Payment Protection Program from the Small Business Administration. And a report just came out of Stanford showing that about 40% of these Black small businesses have closed down. I mean, I think the other thing when we look at this is an example of a 21st century redlining. This was a time where America could have done a reset, but instead did the exact opposite and is actually exposing neighborhoods, people in neighborhoods, kids who are going to have to go back to school during a pandemic, schools that aren't necessarily ready for that. And these lead to disparities. One other report I want to highlight was a pandemic response report that was done by Johns Hopkins. Had a study with 195 countries in it. While the United States ranked #1 in finances, the United States ranked 175th out of 195 when it came to healthcare access. That healthcare access is the inequality that lands on the bodies of Black and brown people.
So with the pandemic being in full force here in the United States, what advantage, if anything, has it created with regard to bringing attention to the disparities and to the issue of, race relations when we've seen, for example, the excessive use of force and police abuse and the George Floyd and all the other cases like his that have brought out an outcry and support from the white community to change things?
So part of what this pandemic has highlighted is not only the racial gap in COVID, but also highlighting police violence and the prominence of it. there's one key statistic. Black Americans are 3.5 times more likely than whites to be killed by police when they're not attacking or have a weapon. Every 40 hours in the United States, every 40 hours, a Black American is killed by the police. That is troubling. These are troubling statistics. In a lifetime, 1 out of every 1,000 Black people can expect to die due to police violence. So George Floyd's death is really the 21st century Emmett Till moment. It's the moment where no one could deny, similar to that casket of Emmett Till's body in 1955, people cannot deny that George Floyd was killed by police and that other police officers were complicit in those particular acts. So part of what's happening at this moment is the pandemic has allowed for people to stop and pause and pay attention, whether that be in mainstream media, local news, on social media, and they are seeing the prominence of police brutality in the United States, and people want to see change. 70% of white people, including a sizable percentage of Republicans, are saying, look, we realize now this is systemic racism and we want it to change.
So we're coming up to the end of our time segment, but what, if anything, actionable would you recommend to politicians and to the audience to put forth to help address these issues?
So I've been talking to a lot of policymakers at the federal, state, and local level. I think when it comes to COVID-19, we need to collect demographic data. We also need to place testing facilities in Black and brown neighborhoods so that they can gain access. On the policing front, we need police reform. I think Democrats and Republicans on the federal level have a lot of things they have in common. And part of this, what we need to do, we need to deal with qualified immunity. And one big thing I've been pushing is making a shift in civilian payouts for police misconduct away from taxpayer money into police department insurance policies. Eventually, George Floyd's family is going to get a large civil payout for the fact that he was murdered by a police officer. But the tax money of his loved ones is going to be used to repay them back for the dehumanization and murder of his death. We need to make that shift. Our tax money should not be used in this way.
Okay. Well, I really appreciate you coming on the show and bringing all that information to the audience. It's a difficult time for all of us, but it's an important time because, as you said, it has given us an opportunity to reflect and to pivot and maybe restart how we see ourselves, see our neighbors, and everybody else. So I really appreciate it. Thank you. I hope you consider coming back.
Anytime. Thank you for having me. I really appreciate the conversation.
Awesome, awesome. So now we're going to switch over to our second guest, Mr. Stephen Blackwell, who is very knowledgeable in from his service, 23 years in the U.S. Public service, doing public health protection and dealing with and thinking about pandemics and diseases and being at the CDC. So, Stephen, thank you for being on the show.
Thank you for having me. And I'd like to say that I would echo that important, powerful message from the professor in terms of the social determinants of health and how we need to be aware of those and work to eliminate any inequities we can. Although I won't be speaking directly to that, all the things that I will be speaking to will have an impact in all the communities as well.
Well, I appreciate that. And that's why I thought it was a good idea to have you both on the same show. Professor Ray can talk about, the policy and the current atmosphere and environment that we're in. But you can tell us a little bit about COVID in the updated version. When we first started, no one was really sure how contagious it was. Does a mask really need to be worn or not? So why don't you give us an updated review about COVID and starting with what is it actually?
Sure. And we have learned a lot, and yet there's still a lot to learn as well. So we're nowhere near a complete set of knowledge about COVID-19, which is the disease, and the SARS-CoV-2 virus. But the symptoms that people need to look out for, primarily in their own selves or their loved ones, are the 7 primary symptoms are cough, fever, chills, muscle pains, shortness of breath, difficulty of breathing, a sore throat, and perhaps a loss of taste or smell that is sudden. So if you have any of those symptoms, and you don't have to have all of them, and there are some others too that may develop in some people, you should seek testing for the virus. And also,
if you're not sure, maybe double check with your doctor. I mean, I know I have allergies, so sometimes when I get a little bit short of breath and coughing because of my allergies, I'm like, oh my God, I got COVID.
There's no question there's no question that the best reference is your own healthcare provider, assuming that you have access to a physician. The public health department is also a good resource, and they can be accessed usually through a website and through emails. And their local public health departments, usually county level, are very responsive and have plenty of information that corresponds to what's happening locally, because that's an issue as well. There are some basics that we all need to be aware of, but the local conditions are what drive a lot of the phases for reopening, and so and the ability and availability of testing in some areas as well.
So what is the test that we should get if we're going to get tested? Or I know there's 2 tests, right?
Correct. There's 2 basic types of tests for one is for the actual virus. Are you sick right then? Or asymptomatic and still have the virus active in your system? And those are the ones that you see most often as the drive-through testing, where they're doing the nasal swabs and they're going deep into the nasal pharynx to get a sample. The other type of test is an antibody test to see if you've actually been exposed and your immune system has developed antibodies to the virus. So the antibody test. Do they know
right now if you have antibodies? Are you immune, or they don't know yet?
It hasn't been confirmed. Again, it's one of the things, as I said before, that we're still trying to learn, and it's being studied as we speak and continuously as to what levels of immunity these antibodies will produce. But also knowing that we use blood plasma as a therapeutic blood plasma, from people who have already had COVID-19 and their blood plasma has these antibodies. It's being used as an experimental treatment and therapy for people who are sick, and is being shown effective. So with that knowledge, you can infer a little bit that there would be immunity. How long that immunity lasts is still in question. So even if you do test positive for the antibodies and you have no symptoms, you still want to practice physical distancing. You still want to wear face coverings. You still want to wash your hands and avoid touching your face and eyes and mouth area to help prevent the spread to yourself and to others.
So I understand that the face coverings have been super important and focused more lately because of the droplets that they found that when you cough or when you expel droplets or whatever, I'm not a doctor, obviously, that it's alive, the virus is alive in the saliva and such for longer than originally was believed. And then there's the difference between aerosol and droplets. Can you explain that a little bit?
Sure. The difference between a respiratory droplet or saliva that comes from our mouths and nose when we breathe or talk or cough, a droplet and an aerosolized or a droplet nuclei is what is also called, is the difference in size. So think of the larger droplets as like grains of sand that come out of your mouth, and they'll drop pretty quickly, and that's why the 6 feet is recommended for physical distancing. So those droplets are known to contain fairly high levels of the virus and are most contagious, and that's how it's transmitted most effectively, is person to person from those droplets within close contact. So the aerosols are smaller particles that still contain virus, but are small enough that they'll actually float in the air. And they're obviously invisible, and most of the droplets are too, but you can see it. The benefit of a face mask or a face covering, it traps the larger droplets from getting farther away from your body. And so if everyone wears a mask, then don't completely eliminate the droplet spread, but we reduce the droplet spread tremendously. The aerosol spread is reduced, and it's still in question as to how much aerosols have an effect, but they are a potential exposure route. So to protect yourself from the aerosols, you want to stay outdoors as much as possible when you're not able to social distance. So you want to avoid large crowds indoors, and you also want to wear face masks, but they're less effective against the aerosols because the aerosols are smaller and can penetrate through the face mask. Doesn't mean that they're not that the face mask should not be used, but
Right.
you want to avoid large crowds indoors. And the other thing with outdoors is that the aerosols themselves will float, will be taken off by the wind and have less concentration indoors, or outdoors, Indoors, they tend to potentially concentrate and float in the air longer, and you can have exposure that way.
And that probably has a lot to do with the ventilation and those kinds of issues. But I was going to say, is that the reason why the jurisdictions that have reopened earlier with allowing indoor dining and bars and those kinds of activities have seen an increase in the spread of COVID?
It's difficult to say. The behavior is very important, and in some instances, people might not have been strictly following all the face masks and fully socially or physical distancing and washing their hands properly. So how much the aerosol potential spread added to it is still unknown. It's
Okay.
simply unknown.
So what is the proper way to wash your hands? I know it sounds beyond, I'm an adult, I should know, right?
It's really not a bad question, and the key to proper hand washing is the amount of time you actually use scrubbing your hands together. So it's actually the physical motion and the physical scrubbing of your hands, and that's anywhere from 15 to 20 seconds is recommended. So using proper soap, using water that's at not too hot or too cold, and rubbing your hands for 15 to 20 seconds, and then completely rinsing your hands is the best way. And drying with a paper towel if you have one. If not, then it's always best to also turn the faucet off with your paper towel as well. So if you're
Especially in a public place, right?
Right.
Right, because those droplets that fall on surfaces are contagious as well.
There is a potential for what's called fomite transmission, which is inanimate objects where these droplets, as we said, do fall, and they can stay on surfaces for anywhere from a few hours to a number of hours. It depends on the environmental conditions. Sunlight has been shown to be a good disinfectant, and so that's another reason that outdoor spaces are less likely to be involved in transmissions. It's really the close contact and the droplet spread between people 6 feet or closer for more than 15 minutes that causes the most transmissions.
So what is the advice that you have for those who want to go out and are tired of being inside?
Yeah, well, I think, all of us have suffered a little bit of cabin fever at different times, especially as the spring and early summer came upon us and the weather's beautiful outside. So I encourage everyone to get out and take advantage of any outdoor space they may have and walk and run and exercise. And as long as you're practicing physical distancing while doing those activities, you do not need to wear a face covering during those activities. It's only when you can't social distance and are closer and are running errands and doing shopping and things along those along those lines where face masks help protect everyone.
So let's say I've had rotten luck. I've already hurt and fractured my ankle, but now I'm facing the issue, the difference between quarantine and isolation. I talked to you before the
Sure.
show about that, for people to understand that there is a difference between those two terms.
Sure.
If I were to have COVID, I would be someone that would then be in isolation, right?
Right. A positive test for COVID where you have active virus, you go into what's called isolation or self-isolation. Hopefully you can go into isolation in your own home and your symptoms don't reach a level that you need emergency care and have to go to the hospital. So that's the hope for everyone, and that's the vast majority of people have that as their endpoint. If you are close contact of someone who has been identified as a positive COVID-19 case, then you go into what's called quarantine. So the case goes into isolation, and that tries to put the person by themselves. The quarantine reason is to see if you're going to get sick yourself. So you have to be symptom-free for 14 days in quarantine because of how long it takes to potentially get exposed from when you were exposed to when you get sick.
Okay, so to actually manifest the symptoms,
right,
and such,
so
take 14 days.
Right.
From
So
when the last time that person no longer is sick, that you were helping or caregiver.
right. If you're a caregiver in the home, the person that's isolated and you don't get sick, you're still under quarantine for 14 days after that person comes out of isolation, because it's to protect everyone, to make sure that you're not an asymptomatic spreader, that you're not, you don't have symptoms, but you still potentially have the virus, especially since we know you've had exposure to someone who has had the virus.
Right. Yeah, and I thought that was something interesting when we talked before the show, that you said just because you get a test today and it comes back negative tomorrow doesn't mean that the next day you don't get exposed and have it. So the testing negative is tricky.
Right, and that's why we recommend from a public health perspective that only those that have symptoms get the test for the active virus. Because again, testing negative today for the active virus doesn't mean you might not be exposed tomorrow, or have been exposed and it hasn't shown up enough to reach testing levels yet. So.
Gotcha. So the audience needs to remember, wash your hands, wear a mask, and stay outside if you're going to get together. Don't go inside.
Yes, and don't wear a mask more than you need to. If it causes any irritation, look for another style of mask. There's lots of different face coverings, and the CDC recommends cloth face coverings. So find what works best for you. I find that the pleated kind works the best, and make sure that you're wearing it tight over your nose and chin, so that it covers your nose, mouth, and chin area. And that'll be the most effective for everyone.
Thank you so much. Thank you for joining us on the show. I really appreciate it. And I would like to thank the audience for watching. Please join me next week at the same time, or watch the show on our YouTube channel, Yesterday, Today, Tomorrow Show. I am Mariana Cordier. Until next time.